Hey guys, I wanted to talk to you today about something that has been on my mind lately. It's been driving me crazy, and that is headaches and migraines. And so there's a lot of people, I don't have the numbers right in front of me, there's a significant percentage of people in America that suffer with headaches and migraine headaches on a regular and consistent basis. And we see a lot of different information about you can take this medication and you can do this over-the-counter medication. They got prescriptions. And guys, it's not that complicated. Migraines and headaches almost always, and there was a research study that was reported, it was over 80% of the time, anybody with a headache or migraine, there was some involvement in the cervical spine. And so I'm going to explain that to you in a second. Some of the other causes can be things such as not drinking enough water, magnesium deficiencies. There's quite a few different studies and reports on magnesium deficiencies creating tension and tightness and muscle problems and that leading to headaches. Not eating, of course, can create headaches. And then either having too much caffeine or not having enough caffeine when you're used to it can also create headaches. But those are not causes. So please understand that those things there's always going to be tension on the spine. So let me show you. When you have slips, falls, car accidents, sports injuries throughout your lifetime, there was a study done in a pediatric journal that said 80%, more than 80% of kids were born with a subluxation or subluxations at the top of their neck. What that means is misalignment in the spine. So this is something that is really, really important to me. I want everybody to understand this. We have this spine. There's a spinal cord inside of it. And then we have spinal bones, right? The spinal cord is wrapped in something called dura, and then there's meninges that attach it to the bones. Hopefully you guys are still paying attention. That doesn't just float. The spinal cord is not floating inside of the spinal column. So if I have trauma with the birth process, if I fall down the steps, if I'm sitting in a desk for an extended period of time. So normally we have a C-shaped curve. We call it the arc of life because the neurology here runs all the vital organs in our body, powers them up. If I lose normal position in the spine, you have to logically understand that that means there's going to be tension and stress on the spinal cord. That's your central nervous system. You can't separate it. If I have a rotation at the first vertebrae in the spine on top of the second, or the second on top of the third, if there's some rotation up here, it puts tension on the meninges, the attachment to the spinal cord. Stress on the meninges puts stress on the nervous system. Stress on the nervous system causes symptoms. So yes, it causes pain and discomfort. Yes, it causes tension, tightness in the muscles, ligaments, and tendons. But I want you to look at this poster real quick. So we have your brain. We have cranial nerves that are involved in that area. You have ear, nose, and throat. You have balance centers. The vagus nerve, which actually controls your digestion, your breathing, your heart rate. All of that stuff is found in the top of your neck. So why do we take care of babies that have colic, or babies that can't sleep, or babies with ear infections? Because the nerves that control the things that are being affected by those problems come from the top of the neck. And if there's tension on the spine, there's tension on the nervous system. It's that simple. How do we know? We test it. We test for it. So we do a physical exam. We check with palpation and see how those muscles are, if they're tight, tense, sensitive. You would be amazed at how many people I go, does this hurt? And they go, yeah, that hurts. I never knew that was even sensitive. And that right there is where the problem was coming from. I saw a kid yesterday. He has low appetite, low energy, can't sleep, always under stress. We have kids that have digestive disorders and skin rash issues and ADHD. And we adjust the top part of their neck, take stress off the vital nerves that run and control function in the body, and all of a sudden things go back to functioning with ease, because that's the way the body was designed to function. It was designed to function smoothly and efficiently. It can't do it when there's stress on the nerves. The body senses that as a stress response, and it starts taking other actions. Those actions would include headaches, migraine headaches, and whatever else. So please, don't be stuck taking medications for the rest of your life without finding out why the problem could be happening in the first place. And more often than not, more than 80% of the time, the cervical spine is involved. So get your cervical spine evaluated. This is our digital x-ray unit. You can kind of see that there. We also do nerve scans. Our x-rays, literally, they pop up within 3 seconds. We can look at it and say, do you see there's some misalignment, dysfunction there or not? It's a yes and no answer. It's black and white, literally within 3 seconds. We'd love for you to find out if we can help you. Stop suffering, start living. The first thing you got to do is just take the initial step. Hope to see you soon.